we're back, and this is kind of a long title, but it's not that bad. I'm just going to compare the endocrine system and the exocrine system, as well as just kind of look a little bit at the difference between the snail mail and the quick email nervous system and endocrine system. So when we're talking about the difference between an exocrine system and an endocrine system, there's a couple of things that you can specifically look for. Exo means out of, and this is going to be external secretion. So like this is everything from um, enzymes or different types of complex biomolecules that the cells of the body have manufactured that are going to be pushed to the outside of the body, right? So, like the surface of the skin would be an example. But then also remember the digestive tract technically is considered like the external part of the body, right? From mouth to anus, like all of that is just going to be. We consider the outside environment, right? We have the microbiome in there, we're pushing through food through there. But what's different is the endocrine system is everything that's considered to be on the inside of the body, right? So these are the internal secretions, and it's generally like a communication as well as like a everywhere from a aging and maturation, long-term signaling, long-term communication and direction type of molecules. So exocrine glands have ducts. They're going to carry these secretions up to the surface. So think, digestive tract is an external secretion or from the surface of the skin. They're going to be on the outside of the cell. That's how they're going to operate. For example, food digestion or, maybe lubricating the skin. Endocrine system is a little bit different. So they don't have any ducts exactly. Um, They also contain dense fenestrated capillary networks. And so fenestrated, as you know, means like holes in the capillary network. Think of it like a soaker hose version of a capillary. And so what that does is allow for really quick and easy pushing out of and pulling into the different cells, different like the hormones that are going to be transmitted through the bloodstream. Also internal secretions as well as the intercellular kind of targeting, and that can affect things such as cell maturation, growth rates, and of course cell metabolism. When we're comparing the nervous system and the endocrine system, things to keep in mind is that both systems serve for internal communication, right? So the nervous system, again, email, and the endocrine system, the snail mail, it's a little bit slower. The speed and the persistence of the response. So the nervous system is really just kind of like a fast note. Like it goes quickly for the most part, milliseconds at the time scale, and like as soon as there's a cessation in signaling, there is a cessation in message transmission. So that's kind of like it can end as quickly as it begins. Endocrine is a little bit different because we're actually making these complex molecules and they are traveling through the bloodstream and they are going to act at their target for as long as it takes until they're degraded, essentially, or removed, otherwise inhibited. And so that affects, including months, especially when we're looking at things like development, um, adaptation to long-term stimuli. So the nervous system, like generally, is a quick adapter. So it's going to turn on fast, like we talked about. It's going to turn off fast. Really, however, the endocrine it's supposed to be. Um, it has that capacity to be longer term because you have to actually degrade it or otherwise inhibit it, remove it in order for that signal to stop. So that's supposed to act as a long-term stimuli in many of these cases, or longer term stimuli. So they impact different areas. So the nervous system can actually target really specific, like down to like individual cells, cell groupings. Like they are generally hooked into one organ, and you can have multiple neurons hooking into that organ from different parts of the central nervous system, for example. However, the endocrine system, because we're producing these molecules that are going to diffuse throughout the body, they're going to have widespread effects. And so they're going to track through the circulatory system into whatever organs they basically hit and can impact after uptake. So the target organs are cells. So all that means is when we say a target organ or cell, that's like who the hormone is talking to, right? So those are the ones that are going to have receptors, right? They are going to be able to grab onto the hormone and take that signal and say, oh, I have it, we can do something now, and we're going to respond to it in whatever way it is, whether it's speeding up metabolism, slowing down metabolism, or beginning puberty, for example. Some of these target cells are going to actually take that hormone, and they're going to use different enzymes, right? So like protein-based machines, and they can convert a hormone that's circulating that doesn't, it's not exactly on active, it's a precursor form, and that enzyme can change it into its active form as well. So, okay. And then I just wanted to show you, here's kind of like just a schematic of these particular cell types, right? And the process of a nervous system impulse. As you can see, here's a neuron on one side. You see the dendrites, right? And so the dendrites are taking in a signal, they're processing it through and past the cell body. That nerve impulse is that action potential that is snapping it all the way down in the electric-like signaling arm of the neuron. It terminates at the axon terminal, and when it does that, transmitter release, and those are chemical signals, and they are going to target a specific cell grouping or organ. And then on the bottom here in the yellow box, this big red kind of bulbous image. So what these are is this is an endocrine system. And so I kind of want you to, notice a few things. So number one, endocrine cells that are lodged in this highly vascularized, right? Like look, it's tons and tons of blood vessels in this network, right? And they are just producing these little green dots of, like, say, hormones, and they're pushing it out into the bloodstream, and they're going to travel. And then if you'll notice, there's actually like a little cut between the first little node and then the second node of cells. And so that's just supposed to represent the distance it travels in the body, right? So when we finally get to our target cell or our target organ, those little green hormones are going to float out of the bloodstream and are starting to aggregate inside some of those target cells, right? And from there, they're going to have different metabolic effects or signal, maybe change some type of production or growth or whatnot in that particular area and or organ. Okay, that's kind of it. So I hope it's helpful, and I hope you're out there somewhere having a great day. Bye-bye.